Hello. Thanks for joining us today for the next presentation in our series of webinar forums on managing stress. This is a joint production of the Department of Psychiatry, the University of Iowa Hospitals and Clinics COPE team, and the University of Iowa Employee Assistance Program. I'm your facilitator, Dr. Laura Fuller from the Department of Psychiatry. Before introducing today's presenter, I have important information about this program. This webinar is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. If you think you may have a medical emergency, call 911 or go to the nearest emergency room immediately. No provider-patient relationship is created by this webinar or its use. Neither the University of Iowa nor its employees nor any contributor to this webinar makes any representations or warranties, express or implied, with respect to the information provided herein or to its use. Now that I've said that, I want to tell you how glad we are that you've joined us today. If you are watching the live stream version of this program, there will be time for a limited number of questions at the end of the presentation. Please use the chat function to submit questions. A recording of this webinar and further resources will be available at the Loop on the hospital website. Our presenter today is Dr. Jamie Elizalde. Dr. Elizalde is a clinical assistant professor in the Department of Psychiatry. She works with children, teens, and families, as well as leading dialectical behavior therapy groups with adolescents, providing training and consultation in the schools, and she's also active in teaching and scholarly work. The topic for today is building and fostering resilience in children during times of adversity. During her presentation, Dr. Elizalde will provide ideas about how children and families can stay resilient as this pandemic drags on. Here to tell you more without further ado is Dr. Elizalde.
Thank you, Dr. Fuller, and welcome to today's forum. Thanks for joining us. I know last week or the week prior, there was a wonderful presentation by Maggie Moore on resilience in terms of adults, and I want to shift the focus a little bit to children and families. So just to remind everybody, in case you haven't been feeling it lately, let's talk a little bit about what resilience is. It's the ability to recover from adversity. So another way of thinking about this is being buoyant, and these are dictionary definitions. Another dictionary definition, which refers more to material than people perhaps, is returning to original after being bent, stretched, or compressed, being elastic. I find it a little humorous to think about the material side of things because I think in a sense we probably all are feeling bent, stretched, or compressed lately. As Dr. Fuller mentioned, the pandemic seems to be going on, and that level of uncertainty in and of itself can create some stress for us. In terms of psychology, what resilience means is adapting to these difficult situations or to adversity and bouncing back from them, not necessarily ignoring them and recognizing that change is difficult, but learning to be flexible and tolerate these situations. In terms of families, there is also resilience, and that is a family's ability to respond to stress and challenge in a positive and adaptive manner by demonstrating competence and confidence among the family members. And of course, with children involved, this is promoting those same characteristics for them. So again, resilience doesn't mean that we don't experience stress or difficulties. Instead, it means that we learn to manage them in spite of facing adversities. It's difficult to imagine going through life without facing adversity. So learning how to manage those is a critical piece of becoming a fully developed human, which is what we work on with our children. So it's nice to know that actually resilience is something that we can learn. Everyone can learn these behaviors, the thoughts and actions that go along with being resilient. It's not something that is a trait or personality characteristic that we're born with. And resilience is renewable. We heard Maggie Moore talk again a little bit about being able to fill your bucket with resilience, and we can help our children and not just give them out of our bucket, but help them to build their own bucket of resilience through different tools. I want to focus on 4 core components: connection, wellness, healthy thinking, and meaning, and talk a little bit about how you can foster that resilience in your children and your families. So first of all, how can you as caregivers foster resilience in children? I was reading an article recently on leaderships, and it was a discussion about how leaders are managing during the COVID-19. And the discussion was that we actually turn to leaders in times of uncertainty. We look to the leaders in our communities, in our jobs, in our organizations to provide us guidance. And you are those leaders for your children and the children in your lives. And emotions are contagious. So remember, children will pick up on your emotions as well. So we want to acknowledge and be vulnerable to the difficulties that we're facing right now. But as leaders for children and families, we also want to practice and model confidence in approaching and tackling these difficulties. It's okay to admit that we don't know and to face the discomfort. We also want to move forward and approach things with a problem-solving mindset. So modeling calmness and providing hope is an important part of being a leader and a caretaker. How do you do this in the middle of trying to manage your own stress? We all, for very good reasons, again, are responding with stress and anxiety to the uncertainty in front of us. A part of how you can do this is to practice your own self-awareness. So being aware of what your own emotional and physical reactions are to the situation and what's happening in the outside world. Taking time to pause and reflect on those things before you react. So planning ahead a little bit about how you're going to manage those situations. Just a little bit more, again, in terms of COVID-19, when we look through psychology at resilience and the study of resilience and other disasters, natural disasters and situations that have happened, this one is different for a number of reasons. One is the uncertainty with which it's continued, but also it's not tangible. It's not something that we can see. We can't really touch it. So it's not really clear exactly what it is that we're managing. And that's difficult for us as adults, and for children that may be even more confusing. So just something to keep in the back of your mind. So I just gave you all of this information on adversity and resilience, and there's probably this feeling at this point in my discussion that there's a little that you can control, and especially in terms of your children. But actually, I want to highlight a few things, and throughout the presentation on resilience, a few key pieces that you actually can manage and control, and are really exciting to me, because these are things that even when we aren't in times of adversity are really powerful tools for working with your children and building resilience. The first is your attention. Children crave, in general, their parents' attention, the attention of the caregivers in their lives. And attention is any form of looking, talking, or touching. So you want to think about where your energy is going in terms of your attention and use it strategically with the children in your lives. We can use our attention to correct children, to remind them that it's time to do homework, that it's time to go to bed. We can also use our attention to highlight and point out the great things that they're doing, the things that model and show us that they are resilient, that they're working toward building strengths. And we really, especially right now, want to focus our attention on those things. More than ever, right now, children are going to be craving attention. And so we want our energy to go to highlighting as much as we can the things that they're doing well with our attention. Another piece that you can control during this time of uncertainty and working with your children is something I've sort of touched upon already, and that is modeling and practicing resilience for yourself. The four components that we're going to talk about next in terms of building resilience are things that are actually given for adults to do, and I've modified them for children. And so practicing these on your own or with your children is a great way to show them that this is how we can be healthy, this is how we can take care of ourselves, and this is how we build resilient youth. So first of all, in this list is building connections. So to build resiliency, we want to build connections, prioritize relationships. We know that when we study the characteristics of resilient children, they feel special and appreciated, they feel comfortable with others, and they've developed effective communication skills to ask others for what they need. This is certainly important right now. And we want to promote communication. We want to teach them how to communicate effectively with others. We want them to have connections with others. So again, as I had mentioned, we can strategically use our attention to provide them with ways to communicate. We want to listen. We want to show them that we're listening. We want to acknowledge their feelings in the situations that they're experiencing right now. We want to help them to label their feelings, and we want to acknowledge for them the things that they're missing out on. At the same time, we want to communicate and help them to notice the things that they have to look forward to. Another way of building connections and prioritizing relationships right now is helping them to stay connected to people outside of the family unit. So we're already getting the knack for this as far as connecting with important people through Zoom, other forms of communication by video, so FaceTime. We also have had a lot of teens recently and children who have made care packages for friends and dropped them off at their houses, leaving them on the front steps so there's social distancing in place. You can also plan regular check-ins or calls with classmates or extended family members. Plan to write letters or emails if there are people that aren't readily available by video or telephone. And a part of this also is helping kids to overcome the discomfort they might feel in these new forms of communication. So again, building resiliency is helping to develop effective communication skills and teaching them how to use these other forms of communication to keep and maintain relationships, and also how to ask for what they need will be an important step. The second way to foster resilience is through wellness of mind and body. So practicing self-care. Self-care is something you've probably heard a lot about lately. Let's break this down in terms of the mind. So I'm sure you've heard by this point to limit media exposure. Stick to just a few sources and try to set planned times that you actually tune in and learn what's happening. It can be really overwhelming, and there are lots of different information sources out there, and some of it is maybe less helpful than other sources. As you're doing that, you also want to think about what your children might be exposed to through your listening and watching habits. Smaller children may be in the background hearing things and not correctly understanding it. So making sure that you are making sure that they're not hearing things they don't understand, and limiting it when they're around. For older children, teenagers, of course, they're going to have the opportunity to tune in on their own. So maybe talking to them and problem solving about what some healthy sources are is a good idea. We know that resilient children, another characteristic of that they have is being able to recognize, label, and manage their own emotions. So helping them to notice what is happening inside and outside of their body right now. So connecting their thoughts, feelings, and actions is a big part of having a healthy mind. So recognizing what their thoughts are, how those might be influencing their actions, and noticing what feelings those are connected to. A lot of times this is something that we experience and we learn by other people's modeling. Right now, in this heightened state, people are experiencing bigger emotions than typical, and that certainly is true for children. So walking them through these steps and helping them to understand what that connection is between what they're feeling, what they're doing, and what their thoughts are can be really powerful. I provided a link at the end of today's talk to a really wonderful collaboration between Imagination Press and the American Psychological Association. Authors of children's books are reading their books aloud online. And this afternoon, actually at 2 o'clock, the author of the book entitled "You Are Strong" reassures children that they can handle big emotions, and gives them sources and ways to do that with different family members. I think this would be a great tool for younger children. For teens, there are a lot of apps that they can use to help them to make these connections between thoughts, feelings, and behaviors. And there are also some resources online at the end of this article. Mindfulness in general is a great way to foster wellness of the mind. Deep breathing, muscle relaxation, downtime, keeping a gratitude journal. Right now, being able to focus on things that have been going well or that we're grateful for is a critical piece to wellness. In terms of wellness of the body, think about building routine. Again, having those consistent expectations provides stability and comfort for children. This is something that they need. We know that resilient children turn into resilient adults, and one of the the characteristics that they have or features that they have when they're growing up is a democratic parenting style. That's a parenting style where there are definitely firm boundaries, so the children know what the limits are, kind of where that final line is drawn in the sand. But there's also flexibility from the parents, allowing the children's voices to be heard and be a part of the decision making and setting those boundaries. So right now that's critical because we know that some of those boundaries have to change because of the different social distancing guidelines and the school closures and different sports activities having been canceled. Boundaries are going to change. So giving the children some voice in that, but then as parents or adults being the caregivers and setting the firm boundary with the expectations made clear can be a really important part of building routine and helping with the healthy body aspect of wellness. And teaching self-care. So Dr. S.B. Pfeiffer gave a back to the basics talk on the ABC please skills, which are from dialectical behavior therapy. So being able to help your children to recognize physical illness and treat it, to have balanced eating, to avoid mood altering substances, have good sleep habits, and getting exercise are all part of that self-care. So when we're looking at the power of your strategic attention, again, that's something that's within your control. What you can do as a caregiver is point out or notice or highlight the times that you see your teens or your children taking the initiative to engage in these things or following through and even making a step toward them. Right now, we want to award and notice the small wins. So, wow, I noticed that this morning you got up and decided to get dressed and go outside for a walk, and I didn't even have to remind you this morning. Or thank you so much for getting to bed and going through your routine in a quick way. I know that it's hard right now with everything going on, and I know that this will be helpful for you. So focusing our energy and attention on those things is going to make children more likely to want to repeat them in the future. A third way to build resilience right now is to find purpose and move toward goals. This helps us to create meaning. So a characteristic of resilient children is that they have learned how to set realistic goals and expectations for themselves. And right now, this is changing. Our goals need to be repurposed. What's realistic and what we can accomplish right now has changed. And as adults and caregivers, we can help children to repurpose those goals. We can help them to recognize how they might change things or break down those big problems into more manageable pieces. So, for example, in terms of schoolwork, if they're feeling overwhelmed right now because suddenly there's so much that they need to accomplish, sitting down with them and helping them to break it into smaller, more manageable parts. Or in terms of sports, maybe they had a goal of competing at a certain level or in a certain position, and that clearly isn't going to be happening right now. But what is it that they can accomplish on their own? What goals can they set? Can they have a personal best in terms of running, or are there some other activities that they can do that will work in that direction? So helping them to set more realistic goals in this time is going to be really important. We know that resilient children believe they have the ability to solve problems and make decisions, and they're more likely then to face challenges rather than avoid them. So again, here we want to acknowledge that there are things that are challenges and difficulties, but instead of seeing these as obstacles or barriers, we want to look at them as problems that we can solve. So this is where, again, as those leaders, we step in and say, you know what, let's figure this out. Let's do some troubleshooting and some problem solving. And acknowledging that it is tough. We don't want to sugarcoat that, but we also want to see this as something we can work through. So with younger children, this might involve more modeling and planning ahead. As the adults, we may need to see where those obstacles are going to come in. So for example, younger children's birthday parties or other activities that they were looking forward to. We might want to say, okay, it looks like this isn't going to happen and we are disappointed, and here's some things we can do instead. Here's some options we have. With older teens, you might want to help them to work through that process on their own. What is the main challenge that they're facing? Help them to identify that, and then help them to identify what their options are and the pros and cons of those options. Finally, in terms of finding purpose and moving toward goals, we know that resilient children have a sense of self-discovery. They recognize their strengths and weaknesses. So asking them questions like, how have you grown during this time? Or what have you learned from this experience? can be really helpful and reflective and give them a greater sense of strength at the end of this all. I can give an example for myself. Greater self-discovery is one of my weaknesses is actually sitting here in front of this camera talking to nobody. And I have learned that in spite of that, I can do it. And each time I do it, I'm becoming a little more comfortable and confident. So those are the sorts of things, again, with your strategic attention that you can point out to your children. You can praise those accomplishments and identify the areas that they've grown in that struggle. Finally, we want to help children to become resilient through embracing healthy thoughts and accepting change. So healthy thoughts means helping to keep things in perspective right now, checking for understanding of what is occurring, so making sure that they actually have the right information again. So there may be misunderstandings. I've heard some younger children being fearful that when they go back to school, they're going to have to repeat a grade. So seeing that those sorts of misunderstandings are clarified. Also, any questions or difficulties they're having in understanding all the information regarding COVID and their own safety or that of family members. Keeping things in perspective is helping with healthy thoughts by helping them to see the future beyond this current situation. It's really hard right now to think past that, but as adults, we can model that and show some of the things that are coming up. You want to watch for black and white thinking or inflexible thinking and model being more flexible, thinking about how we can get through this or what will come next. Watch for phrases that include things like always and never, or I can't, or any other inaccuracies or unhelpful thoughts that may come up. And again, connecting thoughts, feelings, and actions is a really helpful way to help children connect the dots and make it through and develop some more healthy ways of looking at the situation. As a leader and a parent, it is also okay to express optimism. It's okay to acknowledge the difficulty and say, we will find our way through this. We have done this before and we will again. So maintaining a hopeful outlook and visualizing what we want in the future instead of living and facing only the fears that are right here and right now is really critical. And finally, accepting change. Dr. Hart did a talk on radical acceptance a few weeks ago, which is a concept from dialectical behavior therapy. We know that resilient children recognize where they have control and where they don't, and they focus their energy in the places where they have that control. That's being effective, and that's requires us to radically accept things that we cannot control. So it is really important to acknowledge those things and model that for our children. In terms of, again, using our attention strategically, helping our children and teens to identify times in the past that they overcame adversity can be really important, and helping them to identify times that they were brave in the past or times that they were able to become flexible in times of difficulties are things that then give them confidence to trust in themselves that they can also make it through this difficult change. So resilience is a personal thing. It's a personal journey, and you know your children better than a lot of other people in this world know them. In fact, most people. And so you get to be the leader that bravely guides them through this journey. And what you'll have to do is kind of pick through the things I've talked about. Not everything is going to work for every child. You may want to prioritize which areas that you work on for your children. And if you feel like your child is stuck or overwhelmed and can't use the things that we're talking about here, or if you yourself feel stuck or overwhelmed, there are resources at the end of my presentation that you can use. This may be a time for you to reach out and help to build and foster your or your child's resilience with the help of a professional. So thank you again for tuning in. Remember, resiliency is facing adversity, not avoiding it, working through it, and moving forward. And you can teach and model this for your children and use your attention strategically to do it, pointing out the times that they're facing it and working through it independently. Thank you for tuning in today.
Right. Thank you so much, Dr. Elizalde. That was really wonderful. I loved the examples and the things that you covered and touched on from other wellness forums that people might have watched. We have a few questions for you.
Sure.
One question was about labeling emotions. You had mentioned that that's a good thing to teach children to do. We know that some kids tend to go more toward the physical rather than using their words, rather than saying what they're feeling. What are some ways that parents can teach kids to label their emotions?
Mm-hmm. So one thing is, again, as I had mentioned, parents know their children better than anybody else and probably have a pretty good guess as to what's happening to lead to those emotions if they take a step back and notice what's going on. And so labeling and making that connection between what they're feeling on the inside and what they're trying to get through their actions. Actions are usually sending us a message. We're usually trying to get something that we don't have the words for. So teaching them, I noticed that you're really squeezing my hand hard, and we're talking about the fact that we're going to go to the doctor right now. It seems like you might be nervous. So connecting those thoughts, feelings, and actions for them and helping them to notice that, and then giving them a different way of managing the physical piece of that, the feeling that they're having, can be one way of doing that. With older teens, working with them to kind of help them come to their own conclusion about what that emotion may be or what they're trying to get through their action. So kind of guiding them to it instead of helping to maybe phrase it for them.
Thank you. That was helpful. Another thing that a lot of parents are wondering that kind of ties in with resilience is this idea of, how do I help my child weather the changes that are coming when we don't know exactly what they are going to be? We don't know what our summer plans are necessarily going to be. We don't know what school will look like next year. We don't even know what things will be like in 2 weeks sometimes. So as parents are thinking about reintegration or just helping their children be resilient with the changes that are coming, do you have any advice?
I think it goes back to some of the very things that we're talking about, and knowing what we can control and what we can't, and acknowledging that this is difficult and accepting it. Accepting it doesn't mean we like it. It doesn't mean that we approve of it. It doesn't mean that we're resigning to it. It means that we're accepting this is how things are. This is what we have to manage, and then moving forward with that information, however limited or frustrating it might be. So facing that adversity and working through it, and really modeling and practicing flexibility is key. And it's certainly going to continue to be that way as we start to reopen different parts of our society and reintegrate.
All right, one more question. You gave many ideas, and one that I really enjoyed was about using your attention as a parent, noticing things and putting your attention on some of the behaviors that you really want to see more of. So do you have any other, you gave some examples there, but do you have some other thoughts on using your attention and how that can be powerful with your kids or teens?
Mm-hmm. Sure. I think right now we probably have all felt the effects of kids seeking out our attention, possibly when you enter into a Zoom meeting or pick up your telephone or sit down to do work. And then the attention is going to the area where if children feel like they aren't getting enough, they will continue to do those sorts of things to get it. What we want to do is put our attention on the other things that they're doing that we want to continue seeing. So to build a sense of mastery and accomplishment, if there are things they're helping out with around the house, noticing that and providing our gratitude, noticing when they do step out and we have a business meeting and saying, thank you so much. I know that this is hard for you too, and I really appreciate you giving me some space to do this. And as soon as I'm done, we'll be able to talk more. So acknowledging this is hard for them too, and praising those behaviors that that they're working toward.
Thank you. Yes, that totally reminds me of some moments at my house this week where I either felt like it was a parenting fail and I did not pay attention to something, or when I kept some of these things in mind and actually was able to use my attention in a good way. Thank you.
I think that's the last thing, is to, as part of being resilient, is knowing our strengths and weaknesses, and particularly right now, not being hard on ourselves. Being flexible remains key here. We're learning as we go, and that means that some of our goals and expectations change, and that's okay.
That is an excellent point. I think being resilient, you said, means being elastic, bending, bouncing back. And if you're too rigid right now, I think that's when there's the chance of breaking instead of being resilient. So
exactly.
Very helpful. Thank you. So as we wrap up here, I want to say thank you, Dr. Elizalde. We appreciate you sharing practical steps that we can all take to respond to the coronavirus. A recording of today's live stream, as well as links to additional resources related to this topic, will be included on the loop later today. Next time, at our next Wellness Forum on Thursday, we'll be joined by Dr. Carla Hemisath, who will be discussing how to recognize and intervene when someone needs support. Until then, take care, and we look forward to seeing you soon. Thank you.